Okay, so I'm going to be doing sterile nasotracheal suction, and so my patient already has their nasal airway placed. So I've come in, introduced myself to the patient, I've assessed them, washed my hands, and now I'm ready to apply my sterile gloves and go ahead and do the suction. And so I'm going to go ahead and make sure that my patient has already been hyperoxygenated, and so we're ready to do the suction. And so we open the sterile suction catheter kit and we apply the sterile gloves. Okay, and then we're going to fill the little tray with sterile saline. Alright, so I've got sterile hand and I've got clean hand. I'm going to make sure that I have my catheter hooked up to my suction. For an adult, it should be -120 to -150. And then I can make sure that my suction is working by placing my catheter into the sterile water solution and including the thumb port. And that's going to let me know if my suction is working adequately. And then what I'm going to do is put a little bit of this Solugel water-soluble lubricant in the palm of my sterile hand, and then I'm just going to kind of run my catheter tubing through it, and then I'm going to wrap that around my hand. Okay, so then I'm going to go ahead and I'm going to insert the catheter into the patient's nasal airway. I'm going to go down far enough that I can start seeing basically my patient's breath in the catheter tubing, or my patient may cough, and then at that point I'll begin to retract the catheter and suction on my way out, and the whole process should take less than 15 seconds. So okay, my patient's coughing, so I'm going to go ahead and begin suction and removing the catheter. Now I can go ahead and kind of clean out the catheter with my nasal sterile saline over my tray. Otherwise, if they're disposable, they can just go ahead and get disposed. I'm going to go ahead and reoxygenate my patient using my non-sterile hand, and that's going to be for about 1 minute. I'm going to be assessing my patient the whole time. I'm going to be checking vital signs, respiratory rate, heart rate, SpO2 as well, and making sure they're comfortable. And then once I get my patient reoxygenated, I'm going to go ahead and get them to a comfortable position, make sure there's nothing else that I can do for them. Alright, I'm going to go ahead and leave that nasal airway in for you because we're going to be doing suction again. So I will be back to see you later. Thank you.